68 years old farmer present with a skin lesion of his forehead. It has been present for the past 6 months and grown slightly in size during this time. On examination, he has an ulcerated lesion which is the pearly white. So ulcerated lesion which is pearly white and raised edges and that measure 2 centimeter in diameter. What is most likely cause? Here the options are keratoacanthoma, squamous cell carcinoma, pyogenic granuloma, basal cell carcinoma and Bounce disease. So now see 68 years old present with skin lesion in his forehead, but it grows within the 6 months, which is the usually it is shorter time, and this grows slightly in size, but it is ulcerated with pearly white. This is the key point for answering the question. But there is another important, which is the raised edge. That means the edge is increased. So edge increase, duration short, so it indicates is most probably it is due to carcinoma. So as it is the very short time, and another one which is the raised edge. Usually in case of benign case, the edge is regular, normal, and it is usually close to the skin or skin level. So here you can see this is a lesion, and this the edge which is slightly elevated, and there it is the pearly white base. Now see the basal cell carcinoma, it is raised pearly edge. So this is very important. It is the raised, it is the pearly, and it edge usually elevated. So in case of basal cell carcinoma, this is the pearly and pearly white. So pearly white, it is especially dedicated to the basal cell carcinoma, and this is the ulcerated lesion and usually occurs in the sun exposure area, such as but usually most common in the face. And here we can see this picture. This is the edge which is elevated, and the color usually pearly white. So pearly white lesion with elevated edge, it is the diagnosis of the basal cell carcinoma. And here you can see the different type of the basal cell carcinoma. This is the nodular, superficial, pigmented, usually that are not much important. So the another picture showing the basal cell carcinoma, it occurs usually in case of older person and occurs where the sun exposure area, such as the face, hand, in this area, and it is a small, well circumscribed but pearly tan gray papule devoid of the scale. Lesion enlarges with time and tends to ulcerate, and also it is known as the rodent ulcer because it goes directly downward and it may erode the surrounding downward structures such as the muscle, the ligament, and any other structure, even bone, teeth also. So the basal cell carcinoma, it erode all the structure which lies deeper. So it is size usually smaller, but the penetrating capacity is more. So what is our answer? It is the basal cell carcinoma. And what is its main diagnostic point? The main diagnostic point is the pearly white lesion. This is the pearly white lesion and the raised edge. And we say it is very short time. That means it is about 6 months. And as it developed within the very short time, so it is maybe development of the so it is the basal cell carcinoma. Other option here is squamous cell carcinoma, but in case of squamous cell carcinoma, there is keratin plaque, keratoacanthoma, pyogenic granuloma, and Bounce disease. Usually they are benign, but sometimes they malignant in case of the Bounce disease. Thank you.